Good afternoon. Hi, hello. My name is Jarvis Green. I played Sakura Kuti in today's production. Thank you guys so much for spending your afternoon with us. And we have a special guest speaker. This is Dr. Gary Goldbaum. So thank you so much for being here. Obviously, our play sort of, is your mic on?
Am I on?
Yes, you're on. You're on. So Dr. Gary Goldbaum is a health officer and also the director of the Snohomish County Health District. Our play obviously deals with HIV and AIDS, and so we have a few questions that I would like to ask Dr. Goldbaum regarding some health issues in our show, as well as like locally and globally. So first off, can you tell us a little bit about your role as a health officer in Snohomish County and sort of what got you into this position?
Sure. I'm a family doctor by training, but long ago I realized that a lot of what will predict our health has nothing whatsoever to do with going to see a doctor. And I really wanted to influence some of those things that happen well outside the clinic's walls. And in fact, that's reflected, I think, a lot in what you saw tonight. Yeah, indeed, through my experiences in medicine and later in public health, I've been in public health for 30 years, starting at the Centers for Disease Control and Prevention in Atlanta, with the State Department of Health here, and with Public Health Seattle-King County for 18 years before I moved up to Snohomish County's Snohomish Health District. And through all of those experiences, I've really come to appreciate how important it is that we have an environment around us that really supports us being healthy. You witnessed here today all of those things having nothing whatsoever really to do with medicine, but that clearly influenced health. That the human trafficking, the sexual abuse, the sheer violence, and the poverty. At the end of the day, all of those things drove forward the health of an entire community. But you also saw something that's really remarkable, and that is the resilience of a community as it heals itself, as it finds its own resilience. And actually, that's what public health is about today. And so when you ask, well, so what's this public health and what do you do, Gary? My job is actually to try and help a community find its way to being healthy by itself, on its own. And of course, it's going to need some help, no question about it. That's why we have medical services available to us, and I'm certainly glad for all of those. But ultimately, it's in the community, and I think that's one of the most powerful themes that emerged for me in witnessing the musical today. It's fundamentally about those connections we have to one another. So I was truly struck by the hope that emerges from this, despite the deep despair of HIV and AIDS in Africa, where it has been a major killer for so many years. And guess what? It remains a serious problem globally today, and even in our own country, here in our own county, there are people who are still becoming ill every day with HIV and other diseases too that also predominantly afflict those who are marginalized, impoverished, who don't have control. So I was really struck at all the themes that come back to me as a doctor and as a physician working in public health, that ultimately it's all about that control, not only that we have as individuals, but that control that we can have as communities when we all come together.
That sort of segues into our next question, which is sort of like, I think a lot of us already know that AIDS is a huge health issue in Africa. So what about locally? What's the state of the condition sort of in Snohomish County or Washington State?
Here in Snohomish County, we have perhaps 10 to 20 new cases of HIV infection every year. And at any given time, we have several hundred people who are living with HIV and AIDS. We're really blessed in this country that we have access to extraordinary medical care, and most people do have access to that care. It is something that doesn't exist in much of the world. But I think what's really important is for us to step back and realize that although Africa may have millions of cases of AIDS, and we in this county may only have a few hundred, we're not immune. We're not protected from the diseases elsewhere in the world. We are a very small globe any longer. I suspect many of you have heard of Ebola virus and Zika, and those are conditions that will affect all of us, if for no other reason than that they will cause us to think very hard before we travel, for example, or even before we go outside in our own backyards, as we start to worry more and more about, my goodness, is this mosquito-borne disease going to afflict us here? It's a small globe, and that's the other piece of what I'm trying to reflect here, that although AIDS is, I would argue, almost controlled in this country, it remains a huge challenge elsewhere. And it just reminds us again how vulnerable all of us can be, and how fortunate most of us are that we've got the resources to protect ourselves. And so many other people, they don't have the resources or the control over their lives. So ultimately, the work I do in public health is about helping an entire community to recognize how it can be strong for itself. And in being strong as a community, it will make sure that all of its residents will, all of the people who are part of that community will also be strong.
Wow. So even though it's very treatable here, has the public stigma changed at all regarding this disease?
You know, that's another thing that you may have just appreciated from what we saw, that AIDS has been both dismissed and highly stigmatized in places like Africa, and also here. It remains highly stigmatized, even in this country. And it's not the first disease that has had a lot of stigma. Tuberculosis, some of you in the audience may recall tuberculosis, even 70, 80 years ago, was a highly stigmatizing disease. My own father had tuberculosis, and it was very difficult for him and my mother to reveal that ultimately to their own families. That stigma stayed with them for a long time. My father could hardly talk about it. And that's a disease that we almost never hear about in this country any longer. So the stigma remains, and ultimately that stigma works against all of us, because it drives people underground. We don't talk about things, and ultimately we will not heal ourselves as communities. Those challenges are going to face us. They always are going to be here. But when they come to light and we can talk about them, and we won't reject those who become sick, instead, not only they, but all of us will be able to heal as a community.
So that's really interesting. So as a health officer and a doctor, what's sort of your role to help combat those challenges with those stigmatisms and things like that? Yeah.
I loved in the musical, it's a little role when you remember the man who is handing out the pamphlets.
Ah, yes.
That was public health in action, and actually Africa did a remarkable job in educating millions of people, and it changed attitudes, it has changed behaviors, it has changed laws. but it actually started with just a few people who were absolutely convinced they had to get the message out. We're fortunate in this country that that kind of messaging is an accepted part of what we expect of our governments, of our nonprofits that are working to address these kinds of diseases, these conditions, poverty in general. We expect them to be advocating. That was public health in action, and that's really my job, is to educate a community and to see to it that that community knows how to make the right decisions that will protect everyone in the community.
So you talked about tuberculosis and obviously AIDS being a stigmatizing health condition. Are there others that we need to address to sort of help improve health globally?
Actually, there are lots of conditions. I mean, today you've heard about Zika virus and how that's spreading through South America in particular. And remember Ebola. So just a year and a half ago, the stigma of these diseases drives people away from getting help. And so it's a constant battle for public health to try and assure that everyone knows these are real issues. Today, all of the same challenges of decades ago remain with us today. Sexually transmitted diseases like HIV or gonorrhea, syphilis, they're still there. And while some are treatable, even curable, all of them are only going to be addressed adequately if they are something that we all understand. These are not failures of people, faults of people. These are things that we can manage as a society. But if we drive them underground, they will always be there to haunt us.
Wow. So for those of us that are interested to learn more about this, like what can we do to sort of get involved or get more information about, these various conditions?
There are lots of resources out there. For any of you who like to cruise online, you can certainly find a lot of information at the Centers for Disease Control and Prevention, cdc.gov, huge volumes of information. The Washington State Department of Health has a lot of information online, so that would be doh.wa.gov. You can find information and links to all of those sites at our own website for Snohomish County. That's at snohd, snohd.org, O-R-G. Or just Google Snohomish Health District, and you'll be able to link into our site. You'll be able to find additional information. There are a lot of organizations, too, even some locally, that can be a real opportunity for all of you. One that I urge you to explore is called Results. It's an organization that advocates for funding, especially for diseases like HIV and tuberculosis, and especially for programs in other countries. That's because, as I said earlier, we're a really small globe, and there really is no such thing as just the other place. Mm-hmm. That other place is everywhere. It's with us all. So lots of resources out there. Again, the Snohomish Health District, if you start there, you can work your way through the internet universe and find lots of information online. Results is an organization locally that you could connect with. It's actually at local and national. Just go online, Results. Just Google it, and you should be able to find it. I think it's results.org. Those are some great resources for all of you.
Also, Village Theater post all of their talkbacks on their website. So if you don't remember any of the things that he just listed off, you can go to their website, and this talkback with me and Dr. Gary sitting here will be on their website. Are there any questions from our audience before we wrap things up? Do you guys have any questions? Yes, what's your name?
My name is Lisa.
Lisa. Thank you.
Just for Snohomish County, we have about a dozen to 12. So I would agree. The question is, given that HIV and AIDS is a relatively limited problem in Snohomish County, that there are very few cases, relatively speaking, I would absolutely agree. It's not something we want to play out of proportion. The play today gave us an opportunity to think about what's happening locally to connect to the play, but by no means is that really the answer. I think that the real issue here is that any of these conditions, even if they affect a small number of folks, they actually affect the most vulnerable in our communities. And I think the real lesson is that if we want to be healthy as communities, we need to attend to some of those most basic things. What you witnessed here, we talk about poverty, education, jobs. I mean, remember, his cotton crop is failing. When we want to really improve the health of the community, it's bigger issues, but often we start from those smaller things, and then we can connect up and start to appreciate what underlies it. Thank you.
Any other questions? Yes. What's your name? Yes. Sherry. That's a great question.
Well, although I'm not an expert on Africa, I did spend 18 years working with HIV and AIDS, and I have kept abreast of what's been going on, and there have been tremendous advances across Africa. You're quite correct that lack of education is still an important barrier. On the other hand, there have been enormous strides in building effective communications. Much of the communications are not the words. There are stories that can be told with pictures that have been really effective. And of course, word of mouth has always been the most powerful tool, having one person talk to another. And then Africa has also benefited from, to a lesser extent than all of us in the developed nations, but there have been advances in making available many of the remarkable medicines that can control HIV and AIDS. And so there are more people who are benefiting from treatment. There are more people who are well informed about the risks for HIV and for other diseases as well. There's a long way to go. There has been progress. And I think that the play ends on that upbeat note that she graduates. I would say that's kind of a metaphor for much of what has happened, that Africa has also moved forward in a great many ways, and the people have benefited enormously from, and it's not just the medicines, mind you, from remarkable changes in their own behaviors and cultures and understandings.
Yes.
Wow, that was a heavy question, and so I'll give you a brief answer, but then I think we'll need to let you go because this one could be it deserves a lot of deep discussion. You're quite correct that there are very important challenges to the public's health now and into the future, that the traditional public health system is being challenged, just as our educational systems are being challenged. I would argue that the single most important thing all of us can do is to recognize that only by working together, rather than allowing ourselves to be divided, will we overcome those very challenges. They are deep challenges, and I'm not going to pretend to here today that there are any easy solutions. I would say we are fortunate in this state that we have a fairly robust public health system, although I'll also acknowledge that we are under deep challenge to sustain what we've done in the past and what we hope to do in the future. So perhaps I could just end by saying, ultimately, it's not about the government's work. It's about communities that come together. A really effective public health system works incredibly well with its communities. That's what public health is about. Remember, it starts with public, and then it ends with health. So it's about a community working together, all with an eye to making life better for all of us. And I believe that deeply in my heart, and that's why I was so touched by this play, because it it was about that basic theme. A community comes together. That's the most important thing to give us all health.
Thank you. Thank you. Really beautiful. Thank you. Thank you for sharing. Thank you guys so much for staying. Have a great evening. Thank you.